Mujuxis, Kochihi Emma, Kaniastis, Albert Titman, Dumale Nisanan, Miwek, Maidu, Pitt River, and my mother is descended from Mexico. I say good morning and welcome to our training here today, our webinar. My name is Albert Titman. My tribal heritage is Nisanan, Miwek, and Maidu, Pitt River tribal people. My mother is descended from Mexico. My father was a full-blood Native man from all those tribes, all California tribes. My role at Telewell Indian Health is the cultural integration specialist in SUD treatment, and I've been assisting Dr. Springer in really moving forward with developing culturally integrated counseling for Native SUD counseling, and an online or a tele support group. And so it's my honor that I get to share a little bit about Native American culture and the importance of integration into SUD treatment. Next slide. So the outline for our presentation today is really looking at the rationale for targeting Indian country, some basic psychosocial interventions in MAT, again, Native American SUD treatment modalities, some cultural consideration, talking a lot about the Red Road approach and our meeting that we are hosting on Fridays at 2 o'clock, Spirit of Healing. So the rationale for targeting Indian country, and when we look at the opioid epidemic, we have to take a look at the data and looking at the deaths in overall population. California is amongst the lowest states for opioid deaths, but have moved up the list, and some rural California counties with opioid deaths on par with some of the Appalachian states. And we look at 2017, all populations, the overdose rate was 5.3% in the 100,000 people. In 2017, California, American Indian, and Alaskan Native. And so we look at overall population versus targeting the Native community, that rate triples at 17.5 versus 100,000 people. So 3 times the rate. Again, we look at the opioid epidemic in terms of Native communities and being a part of Native communities. And I'm at a training right now as I'm facilitating this at lunch, as we've lost another young person to opioid overdose in one of our tribal communities just this past week. And so the numbers are epidemic. Recent ASAM National Opioid Use Disorder Practice Guidelines describe addiction as a biopsychosocial spiritual condition and reinforce the need for psychosocial interventions. And so what we see is that the importance and really understanding and preparing these guidelines for, especially in Native community, as we develop some of these curriculum-based interventions that are culturally based in this idea of spirituality and healing. A recent survey of SUD programs in Indian country, as well as published findings of an Indian country MAT roundtable, both suggest the significant need for integration of cultural healing methods with MAT. And First Nation study postulated that superior retention rate in their study was due to culturally competent treatment environment. And, you know, a lot of the anecdotal evidence in Native communities suggests that a return to culture, return to spirituality is definitely increasing long-term recovery rates. And so now some research and study is suggesting it's really supporting that idea. Next slide, please. And why is cultural competence important? Is we cannot relate to the basic beliefs and social constructs of our clients, we cannot connect with them a meaningful program that they can relate to. So many will leave a program because it does not speak to the core of their cultural values and experience. And if we can't connect on some level, it becomes challenging for us to, I want to use this word empathy, and not so lightly, but to be able to filter our experience through another person's experience. And working in SUD treatment for the past 20 years, and most of that has been within Native communities, I've recognized that many times we send folks off to dominant culture programs. They either don't stay in the programs because they don't feel this sense of belonging, this sense of identity there, and they'll either leave or the relapse. And so the relapse rates are higher versus programs and there are a number of Friendship House for one, and we'll talk a little bit more about that offer cultural and integrated approaches with Western philosophy and interventions treatment modalities with cultural values and cultural tradition, spirituality. We're seeing those relapse rates diminish or decrease at some level. So having someone that understands at some level cultural competency is important in that respect. Next slide, please. Respect is at the heart of cultural competence. Really this idea of respect for each other's differences, but also respect for each other's uniqueness, respect for each other's beauty, their language, their history, their trauma, really having an understanding at the heart of who we are in terms of understanding each other's culture and cultural values, belief systems. Patients who feel their healthcare providers respect and have some understanding of their beliefs, their customs, their language, their traditions, are more likely to open up and communicate freely and honestly, which in turn can reduce disparities in healthcare and ultimately improve patient outcomes. So it's important that we understand and truly have that respect for self, but respect for others and their differences, their beauty and culture. Next slide, please. The cultural considerations define a Native American-based program. So context, historical and intergenerational trauma is key to conceptualizing the significant stigma-related issues of treatment and the greatest health disparities. And working with tribal communities, we are learning and understanding and growing this idea of historical and intergenerational trauma. And it's key in helping us understand why we have these issues in our community and addressing the stigma, the barriers to treatment for those of us in Native communities searching for ways of healing, especially from substance use disorder. And having those programs that we send our people to or that we attend ourselves with that same understanding of historical trauma, and not to shame and not to lay blame, but to get into the intergenerational healing. And that's what we're talking about. Even today in this workshop that I'm a part of, we're talking about the next 7 generations of healing from this historical trauma and understanding the concept in order to reduce the shame, the guilt, the language that sometimes keeps folks away, this idea of victimization. And we want to turn that into this idea of resiliency and healing, and helping us to understand that and including that in our treatment modalities in order to reduce health disparity. The comfort, non-Native providers are invited. We need you there. We want you there. And to work with our Native population, to work with our relatives. Patients report comfort working with non-Natives when they have a contextual understanding of our history and our experience in this society. Because many times our history is painted as, that happened a long time ago. Why are you still holding that? why are you still carrying that around? That didn't happen to you. When in fact, truly understanding historical and intergenerational in our own states of trauma to this day, it's still with us. And Native patients, people report that when non-Natives have some understanding of that, can empathize at some level, that we can all get into this great place of healing. This there's an old prophecy in some of the Red Road teachings that say there is this great time of healing, that all nations will come together and share our gifts of healing and wellness. And we'll come back together and acknowledge the truth and the history in order for us all to get to this place of healing and wellness and recovery, especially in our Native American-based recovery programs. Next slide, please. More considerations. Communication is key. So building rapport, and many of you probably know this, but building rapport and alliance are more important in many ways than the technique or the theories we use. So being able to listen, and I have an elder that says, Oliver, you gotta learn how to listen with your heart. Connect your head to your heart, all your knowledge, with this ability to listen respectfully, with empathy, with love, with caring. And I know, I'm sure most clinicians that I know, they have that, but sometimes some of us can get too caught up in the techniques or the theory or the modality versus this basic idea of building rapport, trust building, alliance building. Be careful not to interrupt clients when they're speaking or answering questions. Sometimes that's considered a sign of disrespect. I always try to be an active and reflective listener, which means I'm going to wait for the client to say what they have to say, and then I'll respond. Our talking circles teach us that. And when we use the use of an effective talking circle, it teaches us respect for the speaker, but it teaches us to really develop listening skills. Relationship is one of the pillars in the Native community. Effective providers foster a positive relationship with our clients in general, but working with populations that have been marginalized in many ways historically. Trust has been violated. It becomes challenging for Native folks to enter clinics where there may not be a lot of Native staff. And so this importance of relationship building, rapport building, alliance building, relationship building is extremely important, and one of the most effective ways of fostering that relationship. Avoid excessive emphasis on getting answers to those standard intake questions or interviews. Sometimes we have to be patient with certain, and I think that's true with all of the clients that I work with, and I work at the Native American Health Center as well as a substance use disorder client counselor, and I work with all populations, and so it works both ways. But working with Native population and Natives that come to me, and I'm Native, and so they can relate, they open up right away. But I know anecdotally, some of the evidence that I hear is that, I wish I could see you for this other reason because of the difference in culture, or this idea that the provider doesn't really understand their issues as a Native person. So non-Native providers, we encourage you to get involved in local community events and learn as much as possible, especially if you're working within tribal communities and tribal clinics about the local tribes, or equally as important in the urban community. And so I work at the Native American Health Center. It's an urban clinic. I've also worked with Telewell Indian Health, and we're more of a telemedicine program. And I encourage all the relatives that I work with there, Native and non-Native, to come and participate. I invite them to different gatherings, whether it be a big time, a powwow, some of the more closed ceremonies. If you get invited to a sweat lodge ceremony, I would encourage you, if someone is inviting you, if you're invited, to go and be a part of and show your face there. It's a part of that trust building. Next slide, please. Some key concepts, Red Road, this idea of Red Road and the philosophy of Red Road. It is really a philosophy, and we'll talk a little bit about some of those relatives that coined the terms. So when we say Red Road, we are walking the Red Road. You hear that a lot. We mean we are living our lives as true to native values as possible. And there are specific tribes that developed and coined that, and they actually have a word in their language about Red Road and a definition of what that means. And in many tribes now that are adopting this idea of Red Road as meaning this road to recovery from addiction, that is included in that, but it means so much more. It means that we're learning how to live in balance and harmony with all our relations, the relationship we have with the air, the water, the fire, the creator, with Mother Earth, with our cultural ceremonial traditions, with our elders, with our children, with each other, with natives and non-native people. Walking the Red Road means that I'm finally learning to focus on who I am, what my purpose is in life, and where I'm going, my destiny, my vision, my goals. And so when we're able to really understand what walking the Red Road means, it opens up a whole new perspective on life. The medicine wheel teachings, and it's important to know that not all tribes, and there are many tribes across the United States, 570 plus tribes that are federally recognized. Here in California, there are more than 128 federally recognized tribes, and I believe another 73 that are either fighting for federal recognition or are recognized by the state. So it's important to know that not all tribes practice using a medicine wheel. However, many tribes utilize circle or cycle teachings. For example, my tribe, a couple of the tribes, the Miwok, Maidu tribes, were roundhouse people, Hungi and Miwok, Hungi. It's a roundhouse is a house that's in circle form, and you enter from a certain direction depending on what your tribe and that roundhouse teaches. And there are teachings in the medicine wheel that are parallel amongst tribes. Spiritual teachings are parallel, universal. But it's important to know that almost every tribe understands cycles of life, cycles of moon, cycles of winter. All those things are important for us and are parallel and universal in many aspects. So many of us utilize these circle teachings. Many tribes who dance in dance arbors or ceremonial around fires or in powwow, we understand the importance of circle and cycle teaching. These teachings are designed to help us grow and maintain balance emotionally, mentally, physically, and spiritually as we walk and learn to walk this Red Road. So this Red Road, again, becomes this this roadmap for life and how to maintain balance in our life. Next slide. So some of the approaches, the Red Road to Recovery, it was developed originally by Lakota elder now. His name is Gene Thin Elk. And my understanding is they're actually continuing to develop and grow that program. And there's a curriculum-based program, and they're going to be rolling that out, I believe, real soon. But Gene Thin Elk, we have to always acknowledge and honor those elders who laid the foundations for a lot of the work that we see happening generations later. 7 generations teachings. We go back 7 generations to understand how life was pre-contact, what happened historically, intergenerationally, and 7 generations from now. How do we get into the intergenerational healing? What are those things we need to do? Red Road to Recovery, and thank you to Gene Thin Elk that it gives us that foundation to healing the next 7 generations. And White Bison, who the founder and CEO is Don Coyas, and Don Coyas is an elder, and I'm actually a trainer for Don and White Bison. on these curriculum-based interventions. And White Bison and Don Coyas, Don was a man that in his own journey of healing and recovery from addiction developed, actually had a vision, and he shared this vision. And he shared this vision with a council of elders. And the vision, the council of elders told him that he needed to share this vision, and they instructed him on what he needed to do in order to share that vision of healing, that vision of wellness with his people, tribal people. And that has grown into this movement that we now know as the Red Road to Wellbriety movement. And what Don and White Bison has done is develop curriculum-based interventions like the medicine wheel and the 12 steps, the medicine wheel and 12 steps for youth, mending broken hearts, which is a trauma, grief, and loss curriculum-based intervention that addresses healing from trauma, grief, and loss for Native populations. And it includes a foundation of culture, spirituality, and this relationship that we have with the Creator. The Red Road to Wellbriety simply means to follow this path of life, learning and how to maintain wellness and sobriety in our life as an individual, to share that in our family, so family healing and wellness, to share that with the community, our tribal communities, or whatever communities want to be a part of the Wellbriety movement, because it's open for the red, the black, the yellow, and the white, all human beings, and for the nation. And what we say is that many cultures, one nation. So what Don and the Wellbriety movement believe is that we're all human first. And as humans, that we bring our gifts around this sacred fire, and we share those gifts in order for us to heal and grow the next 7 generations. As we've assimilated into the dominant culture, we're reclaiming our role as Native people in these movements of healing and wellness. So we've gone and we've got our education in the Western world. We've got our AA degrees and our BAs and our masters, our doctorates, our PhDs. And now what we're saying is we include an integration of culture and really celebrating who we are as human beings in order to share with our tribal communities and all people this idea of healing and wellness. Next slide, please. So some of the Native American approaches is what we believe is to, in your programs, is to employ at least one individual of Native American ancestry. Many times, and I work with a lot of non-Native programs in our region in referring some of our clients for inpatient or residential substance use disorder treatment. And a lot of the programs, they don't employ a Native person, but one of the things that we've also been able to do is to create MOUs, some contractual agreements that they will allow the Native folks to continue to come and see us at the Native Health Center, or allow them to practice something as what seems as simple as smudging, burning of medicine, prayer, while they're in their treatment programs. But we encourage to have at least one Native person on staff with Native ancestry, and to provide individual counseling for those Native clients, to provide access to a Native elder who conducts ceremonies and provide teachings. So many times our spiritual leaders, our ceremonial leaders, our elders in the community, they're not trained counselors, they're not trained therapists. However, they're in the community and they're offering these services, and there's many times a disconnection from the clinics or the programs to those folks who are resources in the community that have this cultural knowledge, this spiritual knowledge, this ceremonial knowledge. So it's important that you make those relationships to those people who provide those teachings. Excuse me. I'm just getting over a cold, and so I have this cough, and I shook the nausea and all that last couple of days, but this cough is sticking with me. Number 4 is to incorporate traditional native healing practices like smudging, like the roundhouse or sweat lodges. A lot of programs are doing that now. Native and some non-native program. I'm working with a program in Ukiah that historically was a non-native program, but now they've hired a Native American counselor, and that Native American counselor who is also walking the Red Road, he has a sweat lodge there for the program, but he also follows the roundhouse teachings of his people, his Pomo. And so they've integrated that into their program, and we're actually referring clients there. We're actually developing an MOU with them as we speak in order for us to send our relatives away to treatment, and that we know that they're going to receive some of the culturally competent services. And number 5 is to establish aftercare plans by providing community referrals. And of course, we understand the importance of the continuity of care, but also continuous self-care. So knowing those culturally relevant, those ceremonial, those spiritual places in the community that you work with as providers, especially in developing folks as they exit your program and they begin to understand how to maintain self-care. And they know those places, those people in the community that they now have a connection to, because we as providers have helped them. We've made relationships with those places. And so it's important for them to have that. And for you to build that in, I actually build it into my treatment plans, but also into the aftercare plans and making those connections. And number 6, to ensure all counselors are trained and incorporate culturally based curriculum. Again, I promote White Bison because I'm a trainer for them, but there are other programs out there. I know one is is NAFA, Native American Fatherhood and Families Association, and they've developed curriculum-based interventions that address the importance of healthy mothers and fathers, called Motherhood and Fatherhood is Sacred. They have curriculums based that address addressing family violence, addressing or teaching healthy relationships. So they have different curriculum-based interventions. Al Pooley, who I should acknowledge as well, who is the CEO and the founder of that organization, is an amazing man. He's an elder out of Arizona, and he offers trainings in those curriculum-based interventions that he's helped develop. And so ensuring that counselors have some training in culturally based curriculum, and there are other culturally based curriculums available that you can research. I simply say, Google it, and you'd be surprised what will pop up. Next slide, please. And this is really one of the last couple of slides, and it's our meeting at Tullawall Indian Health, Spirit of Healing. It's a virtual Red Road program, and again, in working with Dr. Springer and developing Tullawall Indian Health, and him asking my support in developing and integrating cultural intervention, we thought, how powerful would it be if we had a virtual Red Road meeting, a tele-Red Road meeting? And what we believe that utilization of Native cultural approaches is so important. So what we're doing is, right now we're utilizing the White Bison curriculum, the medicine wheel in 12 steps, this idea of living well sober. Every Friday at 2 o'clock, we host a virtual online meeting and support groups. And we're moving towards all of our clients who want, our Native clients who want a Native American substance use counselor that I'll be counseling here really soon through telemedicine. And this idea of medication-assisted treatment. And we thought about developing, and I'm hearing this out in the communities now, medicated-assisted recovery. So more than, excuse me, more than or adding to the experience of our patients that come to us for medication assisted treatment, giving them the option to learn and develop and grow some relapse prevention tools when they begin tapering, if that's the plan for them to taper, so that when they taper, they actually have some recovery skills developed for their aftercare or their ongoing recovery maintenance. And so developing this virtual Red Road meeting was one of the tools. And we've actually contracted with a program, an online meeting program called In the Rooms. And you can Google In the Rooms, and In the Rooms is a platform that offers so many other recovery support groups, from AA to NA to yoga and recovery, a number of different issues. They have an MAT online group, support group. And so once one of our clients or patients create their own In the Rooms profile, not only do they have access to our confidential meeting, because our meeting is only for our patients and our of Telewell and Springer Behavioral Medicine, but now they have access to other online support groups. And there's an app that they can actually access that on their handheld devices. And so, for example, for many of the folks that receive services through Telewell Indian Health, they come from rural or even frontier reservations where the disparities or access to treatment is minimal. And so for them to have access to a telemedicine approach or a tele-virtual support group is enormous, because many of them have to travel an hour, 2 hours to get to a support group or to get to the clinic for them to receive behavioral health or online or any support group or AA or NA. So this platform really allows for them to have a meeting right in their own living room if they need to. Next slide. So if you want to learn more about Telewell Behavioral Medicine, you can visit our webpage at www.telewell.org. You can type in the Spirit of Healing, virtual Red R, and or you can contact me via email. My email is on the screen. Because if you are a part of this webinar, you are eligible to access our online meeting, our virtual Red Road meeting. We also have Bo Medicine Crow that is actually, I'm only at Telewell on Fridays. Bo is there throughout the week, and he actually will follow up with email follow-up, and he will actually share with you the process of accessing our Spirit of Healing meeting. Again, the Spirit of Healing meeting is every Friday at 2 o'clock, open to American Indian and Alaska Native patients with substance use disorder. But honestly, we have opened it up for all relatives. So we actually do have a couple of non-Native relatives that access the meeting. And as long as they respect the cultural component, the spirit of healing in our virtual Red Road meeting. So with that, I want to say thank you so much for attending our webinar today. There are some references to some of the information that I shared with you today. This webinar will be available also on our website at Telewell. Again, I want to thank you, and if you have any questions or comments, I'd really love to hear what those are.